Hey YouTube! Today I wanted to make a video kind of going around the topic of being a young nurse. What I want to point out is that in no way, shape, or form am I trying to be cocky in any way, if that's what I'm about to say comes across like that. It's just something that I've noticed throughout the past couple years that I've been working as a nurse, as an LVN, and now as an RN. I've been dealing with a lot of some sort of ageism, it seems, and I know it's because I do look young to an extent, I think. I mean, I honestly don't know how old I look, but apparently it looks pretty young to some people. Not only that, I am aware that I think I sound young as well. I think my voice is a little bit higher and not as mature, and I think my word choices don't sound as eloquent when I speak them out. So I do think that it's pretty probable to say that I am a young nurse, but the only thing I have a problem with is how this affects my work sometimes. And I was wondering if I could use this video to kind of see if there are any other young nurses out there that kind of feel the same way I do. I wanted to give a few examples of some of the things that I've experienced as a young nurse, and here we go. So one thing that happened to me earlier this year was I was doing my med pass and I went to a room of a patient that I've known for a very, very long time. I know how difficult she can be, I know how she takes her medications, and I knew she just also broken her hip. So her family members were there because this patient was declining very, very, very fast. It seemed as if it was nearing the end of her life at that point, so family was always at the bedside. When I rolled my cart over and I was prepping my medications, I heard I think it was meant to be a whisper. It didn't come off as a whisper at all, but this guy, who was the son, was whispering to his sister, who was right there, and he said, "Is that our nurse? Do you think she can even answer our questions? She looks like she's 16. And the tone that he had in his voice was very questioning, and I don't know if he meant for me to hear it, but I heard it loud and clear because I was right there at the doorway just preparing my medications for her. When I turned around, I went to the family members, I said hello, introduced myself, helped the patient with her medication, and then he continued to ask me a lot of questions about her, which I was able to answer, but the way that he looked at me was very questioning of my abilities and knowledge and what I could possibly do to help them out. There have been several instances where I would walk into a patient's room, and right when I walk in and I say, you know, knock knock, hi, my name is Caitlin and I'm going to be your nurse today, I'll be interrupted and the patient will say something along the lines like, "Ooh, you are too young to be a nurse. I think I need a new one. Are you sure you're a nurse?" I swear this is really the words that have come out. Even most recently, I walked into the room, I said hi, I had her medications ready, and she said, "Nope, you're too young to be a nurse. Nope, I need a new one. Can you get a new one?" She kind of said it in a joking manner, but kind of not really, that it was kind of, I didn't know what to do, like whether to laugh about it and continue to do my job or to actually take it seriously and wonder if she actually did see me that way, that she saw me as incompetent. Another con that I see of being a young nurse is that a lot of my coworkers around me are typically much older than me. For example, a lot of my CNAs would be way more seasoned than me in the medical field. They've had more exposure and more experience with their patients. I'm over here still learning, but yet I still have to be the one as the charge nurse delegating tasks to those who are older than me, much older than me. It was such a difficult challenge for me to overcome during my first few months working as a new nurse, because it really is so hard. I don't know if anyone else has this problem, but I find it so hard to ask or delegate tasks. I feel like it's not only hard for me to ask them for help, but I think it's also hard for them to hear me ask them for help, because they know that I'm delegating the task to them as their charge nurse, and they will have to follow on through with that task even though they don't want to. I don't know, am I being crazy? I have had situations where I have walked into a room to do a wound treatment for a patient, and their family members will look at me and look at every single move that I do and kind of question, oh, do you know what you're doing? What are you gonna do with that? And I would have to, you know, it's normal for me. I actually enjoy, you know, explaining every procedure step by step because it helps me retain the information and know that I'm doing it right, as well as teaching the patient and whoever's there with the patient as well. I've had problems where I've gone to flush an IV line, PICC line, midline, and it would send an alarm through the family members who are there with that patient, and they'll just be like, oh, what are you doing? Oh, are you sure you can do that? Are you the nurse? There once was a time when I was working as supervisor, and there was a guy, I'm not sure what his position was, but he was looking for the supervisor, but he didn't say anything. I was the only one at the desk, and I was working on my own paperwork, and he was standing there, so I assumed he was looking for someone else. But then after about, I want to say like 3 minutes of silence and him just standing at the front desk, he asked me, oh, do you know when the supervisor will be back? And I looked at him and I said, it's me, I'm the supervisor, I'm the one you've been looking for. Okay, I didn't say that completely, but you know, it just didn't occur to me that he was looking for the supervisor because it seemed like he knew who he was waiting for. I don't know. I know I'm not finishing sentences, but there are just so many stories I have in my archives that have really affected me and made me realize this kind of stigma that young nurses have to go through. And I'm not sure if I'm the only one that has to go through it because, I don't know, it's tough. It's really hard to be seen as so young that your patients, your family members, or your coworkers see you as someone who's incompetent. And maybe that's not how they view me, but sometimes I do feel like that's what they're questioning, that if I am inadequate as a nurse, if I'm trustworthy enough to even do these skills or do these duties and delegate these assignments. And it's always just, ooh, the garage is going on. It's always just been a struggle for me. I don't know, does anyone ever experience the things that I do? Please let me know, because I know there will be a day someday where I'm not considered a young nurse anymore, but I know that time is not coming anytime soon. So anyway, hope you enjoyed this video. I know it was a little different, but thank you always for watching, and I will see you in the next video. Bye.